kuna changamoto ambazo ziko kule mashinani labda ambazo zinazuia sisi kupata huduma za kiafya. Sasa inakupatia ile motisha ya kusafiri kutoka huko mbali kuja mpaka katika Kajiado Referral, kwa sababu unajua kwamba lazima madaktari wapo, dawa zipo.
The goal for providing universal health care is about ensuring that people can access quality and affordable health care they need without financial hardships by 2030. If a country does not have the right personnel and right qualifications, they are likely to have a problem.
The World Health Organization, or WHO, has stated a simple but universal truth. You can have no health care without a health workforce. You can have all the miracle cures you want, but without an adequate health workforce to put those into place and to provide those interventions, you will not have an impact on the morbidity and mortality of diseases in the population. The healthcare workforce is critical to providing universal health care for all.
And I remember the day Agnes walked into my office, and I knew I was a person of passion, someone who was determined to deliver. I was convinced that what she wanted to tell me was good.
The African Health Workforce Project was sponsored by PEPFAR through CDC and implemented by Emory University in collaboration with the Ministry of Health and the health professional regulatory agencies in Kenya. The main goal for the project was to establish an electronic health workforce information system.
We used to use a manual system. And if I tell you it was hell, if you wanted to get a file for somebody, could imagine you can even look for it for a whole month.
In terms of tracking over 60,000 nurses using a manual process was a real tall order. At the click of the button, it was very hard for us to do that.
When the system was deployed, we found that within a second, by a touch of a button, you can have information about somebody. We jumped from months, years, to seconds.
So there are a number of key steps that went to development of the system. We did business process analysis to ensure that the processes are streamlined. We kept on adding features with needs as they come in until this point where the system is quite robust and has been used.
We were also making sure that the other boards and councils could learn from each other, and those that were not at par could be brought up to par, and we could move together.
For Nursing Council, it took about 1 or 2 years to try to get them all running. Then what happened is the projects now started to try moving to other boards. With the experience we had and what we had learned from the Nursing Council offices, so it was fairly easier for us to get the other boards in. All the boards were almost in the same status as Nursing Council. There was literally no IT infrastructure.
It was very important for us to involve all of the beneficiaries of the projects early on so that they felt ownership and part of the project. That's very important for sustainability because if they don't feel ownership, then as soon as the project's over, it just drops. The team here on the ground is made up of Kenyans, not Americans, and that was a deliberate decision that I made as principal investigator of the project because we wanted people to be available here to the regulatory boards long after the project has finished, so they would be able to help them to make the project much more sustainable. In 2016, we were in fact able to transition the project to complete ownership of the agencies themselves, and they're now managing and running the project very well. It's a success, and it's been transformational for them.
We have had a number of innovations. The first one is the online services portal, a one-stop shop whereby a doctor has an account, able to pay for your retention, able to pay for your private practice license, to apply for a certificate of status, among other services. And the beauty about that is that it being mobile friendly, a doctor is able to do it anywhere.
The system has greatly actually impacted in terms of our revenue generation. The revenue that we get from the online portal of our nurses has actually tripled. We have real-time data. We know where our nurses and midwives are at the click of the button in terms of their distributions, their qualifications, and even the good standing that they have for the councils.
So when we were able to get that revenue, we were even able to enhance our operations. And I think if we analyze, you'll see this improvement every year.
Previously, there was a challenge in tracking of healthcare workers. We are now able to say how many healthcare workers graduated successfully and now are ready to be deployed into the job market.
That kind of precision was very easy with the new system, and that has been able to give the government the ability to be able to be in control of the pharmaceutical profession. The illegal premises have disappeared. They can't survive in an electronic environment. The guys who have been registered can now thrive better in a controlled environment.
The database became critical for purposes of recruitment and training institutions to see that the numbers which we were producing then were not adequate. And so that helped the educators for nursing personnel to really expand the training facilities so that we could have enough.
Even if someone has come in as just an ordinary nurse, we can easily know that they have already done some other forms of training. So we can actually deploy in the right place. They will be of more use in that way.
One of the things that we are trying to do is to help them utilize the human resources information data to see how to map out these health professionals into where they are working, see exactly what they are doing, what their deployment areas, and also to look at the disease outcomes as maybe as a result of the quality service delivery that they are giving.
The kind of reports that are being generated from the system are training trends. This information we are using to forecast into the future and see what is required and the resources required, and to inform the Ministry of Health on supply of nurses and midwives in Kenya.
We would easily know the number of personnel per day. If we went to the system, today we will know how many premises are registered.
We know which institutions are registered, what cadre, because you have a health center, you have a maternity nursing home, you have a level 3 hospital, level 5 hospital, you know which hospitals are there. Then you also know which kind of staff you have in certain hospitals. And then you also know what services are being offered in which type of an hospital.
So it is a dynamic system, and so it helps us make decisions very fast.
It's a powerful tool. It's like a powerhouse. We've just begun in the country, but there's still a lot that needs to be done for it to be able to really be used like an empowerment system to make sure that the regulatory system in this country are more efficient, they're more reliable, and they're more acceptable to Kenyans and the public.
If this system is adopted across the East Africa, that means the standards there'll be a standardized way of regulating the clinical officers in the region and also in Africa. And it will also help in setting standards for training, so that now in the region we have one standardized system that is checking on the minimum entry requirements for somebody to be a clinical officer.
We hope this system will be in the African region to strengthen our systems. In fact, in the future, we are hoping we are even going to have interoperability. That, for example, if I want to compare my database with the one in Zambia, I can check online and see how many they have of this specialty.
The next level is to scale up the system to other African countries. A case study is Zambia, who shared the same challenges like Kenya. So the project was able to transfer the best practices and provide technical assistance to the Zambians.
It was quite easy for Zambia to have the system customized and finalized within 2 years, which was half the time that Kenya had taken. When I look back at where Kenya was in terms of system, I really wish that these other countries would have an opportunity to have a system that makes it easy for them to work.